angiomyolipoma. Okay, so in surgery it's very easy to remember the terms. If you do the surgery of terms, what is the meaning? See, the term is angiomyolipoma, so let's break it. It is angio plus myo plus lipoma. So it is the benign tumor which is composed of angio means matured vessel, myo means muscle, lipoma means fat. Okay, so what is this angiomyolipoma? This is benign tumor and it is composed of angio means matured vessel, myo means muscle, and lipoma means fat. Clear? Generally this angiomyolipoma, it is more common in females and it is usually seen in 5th to 6th decade. More common in females and it is seen in 5th to 6th decade. There is one question which is frequently asked in medicine as well as in skin. The question, association of angiomyolipoma. So it is associated with tuberous sclerosis. And in tuberous sclerosis, if angiomyolipoma is there, see, generally angiomyolipoma is single and it is seen in 5th to 6th decade. But if angiomyolipoma is associated with tuberous sclerosis, and in tuberous sclerosis, if angiomyolipoma is there, it is seen in young patients, it is multiple and bilateral. Clear? There are 2-3 questions which are asked in pathology also, that on immunohistochemistry there is one marker which is positive in angiomyolipoma as well as malignant melanoma. So what's that marker? The marker is HMB45. So HMB45, this is a marker which is positive in angiomyolipoma and in malignant melanoma. This was asked many times. Second pathological feature, that in angiomyolipoma there is presence of macroaneurysm. And what is the problem associated or related to macroaneurysm? So these patients have macroaneurysms. Okay, and because of this macroaneurysm, what will be the problem? See the location of kidney. Kidney is located in the retroperitoneum. So whenever this macroaneurysm is going to rupture, what kind of hemorrhage will occur? Obviously retroperitoneal hemorrhage. And this retroperitoneal hemorrhage is seen in 10% of patients. And the name of this condition is Wunderlich syndrome. Clear? So macroaneurysm, it leads to retroperitoneal hemorrhage. And this retroperitoneal hemorrhage is seen in 10% patients. And what's the name? This name is asked in exams. It's the Wunderlich syndrome. This is Wunderlich syndrome. Clear? Now see, in majority of cases, angiomyolipoma is asymptomatic. It's a benign tumor and it is asymptomatic. So how we are going to diagnose any asymptomatic tumor? This is diagnosed incidentally on radiological investigations. Clear? So whenever we are going for CT for something else in abdomen and we are going to find that yes, there is angiomyolipoma in the kidney, right? So clinical features, majority of patients are asymptomatic. Clear? And this is diagnosed incidentally. So the condition is diagnosed incidentally. Okay, we discussed that for most of the retroperitoneal pathologies, what is the investigation of choice for diagnosis? It is CCT. Second important point, for most of the renal tumors, investigation of choice for diagnosis is CCT. So what are the exceptions in renal tumors where CCT is not the investigation of choice? First, Wilms tumor. For Wilms tumor, the investigation of choice for diagnosis is MRI, and whenever there is lymphoma anywhere in the body, investigation of choice is biopsy. So if there is lymphoma in the kidney, what is the investigation of choice? Biopsy. Okay, so see the diagnosis. So how we are going to make the diagnosis? Investigation of choice for diagnosis, and this is CCT. For most of the renal tumors, exception Wilms tumor, where MRI is investigation of choice, renal lymphoma, where biopsy is investigation of choice. Now see, in any patient when we suspect the renal tumor or there is renal tumor. Okay, in that case our first priority is to rule out whether this is RCC or not. And if RCC is ruled out, then we have to focus that if it's not RCC, then what's the tumor, right? Now see, one of the characteristic feature of RCC is what? Presence of calcification. And in angiomyolipoma, the name is angiomyolipoma. So what is one of the characteristic feature of angiomyolipoma? Lipoma, presence of fat. So how you will differentiate angiomyolipoma from RCC? There is absence of calcification and presence of fat. Okay, so on CT there is absence of calcification, clear, and there is presence of fat, presence of fat. Okay, on CT fat is having minus 20 Hounsfield units. So if you do CT, generally fat will be having relatively black appearance. There was an image based question asked in AIMS. See the image. Now see this image. Here you can see what? That there is presence of a tumor in both kidneys. So there is bilateral tumor and it's multiple. Okay. Appearance relatively black and it is having regular and smooth margins. Can you see the margins? It is having regular and smooth margins. So it is looking like a benign tumor. And what is this tumor? This is angiomyolipoma. So this was the image based question. Clear? So here you can see angiomyolipoma. Since it is bilateral, it is multiple, so the chances are that it is associated with which condition? It is, this patient is having what? So this is association, right? Diagnosis is done. Now coming to the management, we discussed that in majority of cases patients are asymptomatic. So see, if the patient is asymptomatic and size of tumor is up to 4 centimeter, only observation is done. And if patient is having symptoms or size is more than 4 centimeter, in that case we have to remove the tumor with margin, and this is known as partial nephrectomy. And what is the other term used for partial nephrectomy? It's known as nephron sparing surgery. Okay, so see, management, it's easy. If the patient is asymptomatic and the tumor is up to 4 centimeter, in these cases we go for observation. Clear? When the patient is symptomatic or the size of tumor is more than 4 centimeter, in that case we go for nephron sparing surgery. And what is the other term used for nephron sparing surgery? This is also known as partial nephrectomy. Simple. Now imagine sometimes patient is coming to your emergency because of bleeding. So if bleeding starts in the tumor, then we go for angioembolization. So if the patient is having bleeding, so for this bleeding manifestations, what is done? We go for angioembolization. Clear? So this is how we manage the angiomyolipoma.